Rear Admiral Weahkee, thank you for visiting with me this past week, but also thank you for your several visits up to the state to know and understand better some of the conditions that Alaska Natives are facing when it comes to delivery of health care. I also appreciate your comments this afternoon as it relates to recruitment and retention and what can be done here, what we can help do in terms of encouraging more to come over to the IHS system and making available the scholarship and the loan repayment programs that are offered by National Health Service Corps and the loan repayment programs and the exempt scholarship provisions that would help you, I think, be a little more competitive. Know that that's something that I think is an important way that we can assist. I also want to raise an issue that we had discussed, and this relates to water and sanitation. As you know, in far too many of our rural communities, we have communities that lack any level of basic sanitation needs being met. We have no running water, we have no sewer facilities, and when you are not able to have clean water to drink or to bathe in or to clean your clothes, your home, disease is allowed to accumulate. We have issues, whether they are respiratory issues, whether they are just communicable diseases that are shared. I think we recognize that these are a key and an integral part to how you are able to better provide for the healthcare needs of so many in my part of the country up in Alaska. We know that Public Health Service, IHS, has recognized that it makes sense to provide some incidental benefits to non-Indians in an Indian community in order to get the full sanitation benefits to the folks that are there. You've got authority under the Sanitation Facilities Construction Act, but as we had discussed, there have been interpretations more recently through the IHS that are perhaps more stringent as to how those rules apply to non-Indian community and requiring IHS to then pay the pro rata contribution for whole projects, which then make it absolutely impossible, infeasible to move forward. So I'm hoping that we can continue to work with you to ensure that we are able to do right when we say we want to meet the statutory obligation of serving our Native communities as a whole. And this is something that is going to be a more complicated and a broader approach, but I hope that I've got your commitment to work in these areas where we know we will have direct and positive impact on health outcomes.
Thank you, Senator Murkowski, and I really enjoyed our conversation. You have my full commitment to continuing the dialogue and to work with our partners throughout government and the Environmental Protection Agency and the U.S. Department of Agriculture to blend the resources that they receive to meet the needs of our Indian communities and our Indian homes as well. We know that in personal visits that I've had the opportunity to make to Shishmaref and Wales, I've had the opportunity to see firsthand the limited facilities, the solid waste concerns, the pass system in some communities that's been used as an innovative way of addressing sanitation. You definitely have my commitment to continue scanning the landscape for innovative solutions and to best use the Indian Health Service's resources to meet the needs throughout Indian country. We're talking about Alaska here specifically, but Navajo Nation has many homes still without running water as well. Ensuring that those formulas are constructed in a manner that gets the money to the locations that need it the most. In today's day and age, as I've heard you say many times, we should not be relying on honey buckets, and we should really take a public health approach to meet these needs.
Well, I appreciate the recognition that we need to have these various federal agencies working together. The end goal is the overall health of our native peoples. And when we get siloed because USDA has an interpretation of language that is one way, EPA has another, and we can't migrate through these silos, we're not able to accomplish what we need.